Today we are discussing about the anterior triangle of the neck. Okay. So here in this picture you can see we have anterior triangle and posterior triangle. So what are all the important structures you have studied in the posterior triangle? So tell me the boundaries of posterior triangle. Okay, so every triangular structure have apex, base and medial border and lateral border, right? So base of the posterior triangle is formed by, okay, apex is formed by, okay, medial border or other boundaries of your triangle is formed by, okay, posterior border of trapezius. Fine. Okay. So what are all the contents of posterior triangle? What are all the contents of posterior triangle? Okay. What are all the arteries we see in posterior triangle? Okay. Fine. Okay. Occipital artery. What about the nerves? Okay. Any important lymph node? Stop talking. Any important lymph node in the posterior triangle region? Okay. Okay, fine. Any other structures? What about nerves? What about nerves we see in the posterior triangle? Okay, spinal accessory nerve. Okay, supraclavicular. Which nerve? Okay, fine. What about the clinical anatomy? Clinical importance of posterior triangle. Stop using your phones. Tell me the clinical importance of posterior triangle. Huh? Okay. Okay. Any other importance? Clinical importance of posterior triangle. What is the difference between anterior and posterior triangle of the neck? Is there any difference? So your posterior triangle is generally present in this, like this, right? So this is the base, apex, and these are the medial border, and this is the lateral border. But your anterior triangle will be present as an inverted triangle, like this. So this will be the base, apex, medial border and lateral border. So now imagine this is your neck region. Okay, and this is the mandible part. This is the mandible and this is the neck region. And this is the midline of your neck. Your anterior triangle will present like this. This is your anterior triangle. Okay. So this is the base and this is the apex. Medial border of your anterior triangle, stop talking, is formed by the median plane of the neck. Okay, and the lateral border is formed by the anterior border of which muscle? Anterior border of sternocleidomastoid muscle. Meeting of your sternocleidomastoid muscle and the median plane of the neck forms the apex of your anterior triangle. Okay, and the base is formed by the imaginary line drawn between your angle of mandible. Which is the angle of mandible? Show me the angle of mandible where we can see the mastoid process. Okay, so your base is the imaginary line that present between the angle of mandible and the mastoid process. Okay, mandible and mastoid process. These are the general boundaries present in your anterior triangle. Is there any division in the posterior triangle? What are those? Occipital triangle and sub. Okay, fine. So there are two triangles or subdivisions in your posterior triangle. In anterior triangle, we have 4 subdivisions. Okay, the one present below your chin part, that is somewhere here, it is called this one. It is called submental triangle. Okay, and in the anterior triangle, we have 3 important muscles. The first one is sternocleidomastoid muscle. The second one is which one? Omohyoid muscle, and another one is digastric muscle. Okay, here we have the digastric muscle. Imagine, so this part will give rise to your digastric triangle, and later here we have the important triangle, that is carotid triangle, and the remaining, this one is the muscular triangle. These are the 4 divisions of your anterior triangle. The first one is submental, the second one is digastric, third one is carotid triangle, and the last one is muscular triangle. Among all the 4 triangle, carotid is the largest one. Okay, this is all about the introduction to your anterior triangle. Any doubts in this? Any doubts? So the medial border of your anterior triangle is formed by the median plane of the neck. Okay, lateral border is formed by the anterior border of the sternocleidomastoid muscle, and the apex is a point where the sternocleidomastoid muscle and the medial plane of the neck meets. Base is the imaginary line that we draw between the angle of the mandible and the mastoid process. Okay, we have 4 subdivisions in the anterior triangle. We have submental triangle, digastric triangle, carotid triangle, and muscular triangle. Among 4 muscles, carotid triangle is the largest muscle. Okay, any doubts? Any doubts in this? Okay. Here you can see this is the anterior triangular region, this one is the digastric muscle region, and this is the submental triangle, and this entire region is the carotid triangle, and last this one is your muscular triangle. We have three important muscle. This is the sternocleidomastoid muscle, the next one is the digastric muscle, this is the digastric muscle. In the digastric muscle we have anterior belly and posterior belly, remember this point, and the next one is omohyoid muscle, this is the omohyoid muscle. And again your omohyoid muscle is divided into two parts. In few textbook it is mentioned as anterior division and posterior division. In few textbook it is used the word superior and inferior part. Okay, you can use both the words. So this is the anterior division of omohyoid muscle and this is the posterior division of the omohyoid muscles. Okay. The anterior triangle of the neck lies between the midline of the neck and the sternocleidomastoid muscle. It is subdivided into smaller triangles. This region includes a strip of 2 to 3 cm wide extending from the chin to the sternum part. The structures encountered are listed below from superficial to deep part. Skin, it is freely movable over the deeper structures due to the looseness of the superficial fascia. Then we have superficial fascia. It contains the upper part, that is the platysma, and next we have anterior jugular vein, submental lymph node and transverse or anterior cutaneous nerve. Remember, in the superficial fascia we have platysma, anterior jugular vein, submental lymph node and anterior cutaneous nerve. These are the important structures. You can see here, this is the sternocleidomastoid muscle and this is the platysma. It is present along with your which layer? Deep cervical fascia layer. Okay. Next we have anterior jugular vein here, then the clavicle part, and this is the base of your mandible. Next, the boundaries. The boundaries of the anterior triangle, the anterior median plane of the neck which is present medially, then we have sternocleidomastoid muscle which is present laterally, base of the mandible which forms the base along forming the imaginary line, then we have a line that joins the angle of the mandible to the mastoid process. Then we have subdivision. The anterior triangle is subdivided by the gastric muscle and the superior belly of the omohyoid muscle. Those are submental, digastric, carotid and muscular triangles. Okay, you can see here the picture. This is the digastric region that forms the digastric triangle, and here we have submental triangle. This whole triangle is your carotid one, and the last one here we can see the muscular triangle. Okay. The first triangle is submental triangle. Your submental triangle is bounded by anterior belly of the corresponding digastric muscle on both the sides. Then the base is formed by the body of the hyoid bone and apex lies at the chin point. The floor of the triangle is formed by the right and left mylohyoid muscles and the median raphe uniting them. Okay. This whole structure is your submental triangle. Okay. See here, the anterior belly is present on the anterior belly of the digastric muscle present on each side. So you can see here, this is the anterior belly of the digastric muscle which is present on the each side. Okay. And base is formed by the hyoid bone. This is the hyoid bone. The base is formed by your hyoid bone. The base is formed by the body of the hyoid bone. And apex lies at the chin point. This is the chin point. Okay. Next, the floor of the triangle is formed by the right and left mylohyoid muscles. This is the mylohyoid muscle. The floor of your submental triangle is formed by the mylohyoid muscles. Okay. Any doubts? Any doubts in this? So the borders on the each side of your submental triangle is formed by the anterior belly of the digastric muscle. Base is formed by the hyoid bone, and next apex is formed at the chin point. The floor is formed by the mylohyoid muscles on both the sides, right and left mylohyoid muscles. Okay. Next, the contents of your submental triangle. 2 to 4 small submental lymph nodes are situated. Along with your submental lymph node, we have submental vein. These are the two important contents we see in this triangle. You have to remember the word submental lymph node and submental veins. Okay. Submental lymph nodes are situated in the superficial fascia between the anterior bellies of the digastric muscle. Here you can see these are the anterior belly of digastric muscle, and this is the submental lymph node, okay, which is present between your digastric muscles. And they drain starting from the superficial tissues that present below your chin region, followed by the central part of the lower lip, then to the adjoining gum part, then anterior part of the floor of the mouth, then to the tip of your tongue region. Okay. This is how the lymph node will flow in your submental triangular region. Any doubts in this? In the content parts, you have to remember only two names, that is submental lymph node and submental veins. Okay. The submental veins later join to form your anterior jugular veins, that is present in your neck region. Okay. The next triangle is digastric triangle. Stop talking. Digastric triangle. The area between the body of the mandible and the hyoid bone is known as the submandibular region. Submandibular region is again a separate chapter. Every structure present in your submandibular region will be discussed in detail in that chapter. Okay. The superficial structures of this region lie in the submental and also in the digastric triangular part. Boundaries. The boundaries of the digastric triangle are as follows. Antero-inferiorly, it is bounded by the anterior belly of the digastric muscle. Postero-inferiorly, it is bounded by the posterior belly of digastric muscle along with your stylohyoid muscle. Okay. You can see here, this is your stylohyoid muscle and this is the posterior belly of the digastric muscle, and this is the anterior belly of the digastric muscle. So this is your triangular area. This is the digastric triangular area. Antero-inferiorly, it is bounded by anterior belly of the digastric muscle, and postero-inferiorly, it is bounded by two muscles, that is posterior belly of digastric muscle and stylohyoid muscle. Okay. Any doubts in this? Okay. Superiorly, that is the base of the triangle is formed by the base of the mandible and a line joining the angle of the mandible to the mastoid process. It is similar to the introduction part what I have mentioned. The base is formed by the line joining between your angle of the mandible to your mastoid process. Okay. Roof. Roof of the digastric muscle is formed by the skin, superficial fascia and also the deep fascia. In the superficial fascia, we can see the three important structures which I have already mentioned, that is platysma, cervical branch of the facial nerve and the ascending branch of the anterior cutaneous nerve. You have to remember the word anterior cutaneous nerve. Okay. Next, the deep fascia which splits to enclose your submandibular salivary gland. we have discussed about the parotid gland, right, in the previous classes. Like that, we have one more important structure, that is submandibular salivary gland. While discussing about the submandibular region, they will discuss about this gland in detail. Okay. The floor of this triangle is formed by the mylohyoid muscles anteriorly and by the hyoglossus posteriorly. You can see here, this is the mylohyoid muscle which forms the floor of your digastric muscle anteriorly, and the hyoglossal muscle, it forms the floor of the triangle posteriorly. Okay, these are the other two important structures you have to remember. A small part of the middle constrictor muscle of the pharynx will also appear in the floor region. You can see here. This is the anterior belly of digastric muscle that forms the antero-inferior border, posterior belly of digastric muscle that forms the postero-inferior border. And the floor is formed by the hyoglossus muscle and mylohyoid muscle, and also a part of, very small part of the middle constrictor of your pharynx muscle. Okay. Contents, we have anterior part contents and also posterior part contents in your digastric region. Okay. Anterior part of the triangle, that is the structure that is present superficial to your mylohyoid muscle. Okay. Superficial part of the submandibular salivary gland, submandibular lymph node along with your facial vein and facial artery. Here the facial artery is present deep to your facial vein. Okay. The next one is submental artery, mylohyoid nerves and vessels. The last one is hypoglossal nerve. Okay. These are the structures present in the anterior part of the digastric muscle. Then on the posterior part of the triangle, we have, in the superficial part, we have lower part of the parotid gland and the external carotid artery before it enters to your parotid gland. So from which part of the parotid gland your external carotid artery will enter? From which border or from which part? From the posterior surface. Posteromedial surface. Okay. So from which part of the parotid gland your external carotid artery will enter to it? One answer is posteromedial surface. Any other answers? Posteromedial surface is the right answer for the external carotid artery to enter into your parotid gland. Okay. Deep structures that present in your triangular regions are styloglossus muscle, stylopharyngeus muscle, glossopharyngeal nerve, pharyngeal branch of the vagus nerve. How many branches are there in vagus nerve? What are the branches of vagus nerve? At least how many branches are there in vagus nerve? Stop writing, everyone. Tell me how many branches are there in vagus nerve. Do you know any branches from the vagus nerve at least, other than the pharyngeal branch? Recurrent laryngeal, okay. Superior laryngeal, okay. Pharyngeal, okay. I said except pharyngeal. The next structure is styloid process, and also we can see the part of parotid gland in your digastric triangular region. Okay. These are the important contents present in the digastric triangle. We have anterior part and posterior part. In the posterior part, again we have two subdivisions, that is superficial structures and deep structures. Okay. These are all the contents we see in the digastric structure. Triangle. So now tell me the boundaries of digastric triangle. What are all the boundaries of digastric triangle? Antero-inferiorly it is bounded by posterior-inferiorly it is bounded by base is formed by mandible. Okay. Any other boundaries? Floor. Okay. Floor is formed by which muscles? Mylohyoid muscle. Anteriorly and posteriorly it is formed by. Okay, fine. What about the contents? What about the contents of digastric muscle? We have two parts, that is anterior part and posterior part. Okay, you should know the different structures present in both the parts. What about the boundaries of submental triangle? Okay, anterior belly of digastric. Anterior belly of digastric, stop talking, is present on both the sides. Other than that, base is formed by the hyoid bone. Fine. Floor is formed by the mylohyoid muscle. Again, it is present on the both the sides. That is right mylohyoid muscle part and left mylohyoid muscle part. What about the contents of submental triangle? Submental lymph node and submental veins. Okay. So is it clear, both the triangles, submental triangle and digastric triangle, for everyone? Any doubts? No doubts? Any doubts in these two triangles? Okay. The deepest structures present in your which triangle? Digastric triangles are internal carotid artery, internal jugular vein and also vagus nerve. These three structures you can see in your carotid triangle also. Okay. These are few important structures you see in both your digastric triangle and also in carotid triangle, which is present in the deepermost parts. Okay. Next we have carotid triangle. Carotid triangle is the largest triangle present in your anterior triangular region or in the anterior neck region. It also includes one more important concept called carotid sheath. Okay. Boundaries, anterosuperiorly it is formed by the posterior belly of the digastric muscle and also the stylohyoid muscle. Antero-inferiorly it is formed by the superior belly of the omohyoid muscle. Posteriorly it is formed by the anterior border of your sternocleidomastoid muscle. Roof, again roof is similar to your digastric muscle. We have skin, superficial fascia and deep fascia. Your superficial fascia, here also it includes platysma, cervical branch of the facial nerve and also the transverse cutaneous nerve of the neck region. Okay. Then we have the deep cervical fascia. Floor is formed by the middle constrictor and inferior constrictor of the pharynx and also by the thyrohyoid membrane. Okay. Remember, anterosuperiorly it is bounded by posterior belly of the digastric muscle. Antero-inferiorly it is bounded by superior belly of the omohyoid muscle. Posteriorly it is bounded by the anterior belly of the sternocleidomastoid muscle. Then we have skin, superficial fascia and deep fascia. In superficial fascia we can see the platysma, cervical branch of the facial nerve and also the anterior transverse nerve. Okay, anterior cutaneous nerve. Floor, here it is formed by the middle and inferior constrictor muscles of the pharynx and by the thyrohyoid membrane. Can you identify the structures here? Here we have the middle constrictor muscle, inferior constrictor muscle and also the thyrohyoid membrane, which forms the floor of your carotid triangle. Okay. Any other structure you can notice here? Superior belly of omohyoid, which forms the medial border of the triangle, and lateral border of the triangle is formed by the anterior border of the sternocleidomastoid. So this here we can see the sternocleidomastoid muscle, and here we can see the superior belly of the omohyoid muscle. Okay. And what about this? This is the upper border, which is formed by the posterior belly of the digastric muscle. Okay. For carotid triangle, these are the pictures or diagrams you have in textbook. If you can draw any simplified diagrams, it is acceptable. Okay. Any doubts in this? Any doubts in the boundaries? No doubts? Stop talking. Next, the contents of your carotid triangle. Carotid triangle includes common carotid artery, internal carotid, that is a branch of common carotid arteries, internal carotid artery and external carotid artery. The common carotid artery with the carotid sinus and the carotid body at its termination. The external carotid artery with its superior thyroid, lingual, facial, ascending pharyngeal and occipital branches. Okay. So what do you mean by carotid sinus and carotid body? Right, carotid sinus and carotid body has a assignment question. It's just like one sentence definition, that's it. Go and search in your textbook once, okay? Next, veins. We have internal jugular vein, the common facial vein draining into your internal jugular vein, and pharyngeal vein, which again drain ultimately into your internal jugular vein, the lingual vein, which usually terminates in the internal jugular vein. Okay. Now we have the vagus nerve, superior laryngeal branch of the vagus nerve, which later divides into external and internal laryngeal nerves, the spinal accessory nerve, hypoglossal nerve and hypoglossal nerve. These are the important arteries, veins and nerves we can see in your carotid triangle. So first we have common carotid artery and branches of the common carotid artery, that is internal and external carotid artery. In nerves we have vagus nerve, and vein we have internal jugular vein and some other veins which come and drain into your internal jugular vein. Those are common facial vein, pharyngeal vein and lingual vein. Okay. Any doubts in the contents? No doubts? So from which part your common carotid artery enters into your neck region? From anterior, posterior, medial, lateral, from which side? From the anterior. Okay. Any other answers? Okay. This is how the structure of your artery, vein and nerve usually look in the neck part. Okay. Can you identify the important structures here? Stop writing everyone, concentrate here. Do you guys have assignments, record submission, anything? So can you identify the important structures related to the carotid triangle in this picture? Okay. In the carotid triangle region, we have an important structure called carotid sheath. Remember the femoral sheath? What is femoral sheath? What is femoral sheath and what are all the contents you can see in the femoral sheath? What is femoral sheath? And what are all the contents of femoral sheath? Okay. How the femoral sheath is formed? How the femoral sheath is formed? Okay. In the neck region, we have one important artery, that is your common carotid artery. Okay. This is your common carotid artery. Later it will divide into two branches. Right. This is your common carotid artery. This is the internal carotid artery and this is the external carotid artery. And here we have one more important vein, that is internal jugular vein. These two structures in your neck region is covered by a thin sheath that is called carotid sheath. Okay. This is called carotid sheath. So your carotid sheath is the condensation of the fibroareolar tissue. Remember this point, your carotid sheath is the condensation of the fibroareolar tissue that covers your internal common carotid artery, internal jugular vein and also your vagus nerve. Okay. Vagus nerve is present between your artery and vein. This is the vagus nerve. And your carotid sheath only covers the internal carotid artery and not your external carotid artery. Okay. Your external carotid artery is present outside the carotid sheath. Any doubts in this? Any doubts? No doubts? So if I take a cross section of this part, it looks like this. Okay. So this is the artery, this is the vein and this is the nerve and this is the vein. Okay. So now this is the anterior wall and this is the posterior wall. On the anterior wall we have two important structures, that is the superior and inferior part of the vagus nerve. Okay. On the posterior wall region we have one important structure, that is the sympathetic trunk. Okay. These are the few important structures we see in the carotid sheath part. Any doubts? Any doubts in carotid sheath? No doubts? Okay. So your carotid sheath is the condensation of the fibroareolar tissue that covers your common carotid artery and also its branches, that is only the internal one, not the external one. Then it also covers your internal jugular vein and vagus nerve. So if I take a cross section, we have anterior wall and posterior wall. The anterior wall of the carotid sheath is related to the superior and inferior part of the vagus nerve and posterior wall is related to the sympathetic trunk. So what is the significance of carotid sheath? And remember two more points, your carotid sheath is overlapped by the sternocleidomastoid muscle and it will present attached to your deep cervical fascia. Okay. So what is the significance? Is there any need to present? We already have superficial fascia and deep fascia, right? So what is the point of one more layer? So write assignment for the significance of carotid sheath. Okay. You should know why the carotid sheath is present and what is the importance of this particular sheath. Any answers? Protection. Okay, fine. Any other points? But there is already, we have skin, superficial fascia and also deep fascia. And in the neck region, we have one more important structure like platysma. So like we have like 4 layers of protection already. So what is the purpose of cervical fascia again? Just write assignment once for the significance of. Any doubts? Any doubts in the boundaries, contents and carotid sheath points? Again, carotid sheath is a separate question for your 5 marks, okay? You have to draw 2 diagrams, you have to explain the formation, contents and you have to explain each and every artery, vein and nerve present in your carotid sheath. Okay? Any doubts? Any doubts in this? Okay. Next important topic is Ansa Cervicalis. So what is Ansa Cervicalis? Okay. Stop talking. What is Ansa Cervicalis? Okay. So your Ansa Cervicalis is a thin nerve loop that lies embedded in the anterior wall of the carotid sheath over the lower part of the larynx, and it supplies to your infrahyoid muscles. The formation of your Ansa cervicalis includes the superior and inferior root. I already mentioned here the anterior wall of your carotid sheath have superior and inferior roots of your vagus nerve. That forms the Ansa cervicalis and it supplies to your infrahyoid muscles. The superior root is the continuation of the descending branch of the hypoglossal nerve and its fibers are derived from the first cervical nerve. This root descends over the internal carotid artery and also the common carotid artery. The inferior root or descending cervical nerve is derived from the second and third cervical spinal nerves. As this root descends, it winds around the internal jugular vein and then continues antero-inferiorly to join the superior root in front of the common carotid artery. So all you have to remember is Ansa cervicalis is a thin nerve loop that forms from the superior and inferior root part of the vagus nerve that present on the anterior wall of your carotid sheath. The superior root is formed by the or derived from the first cervical nerve, whereas the inferior root is derived from the second and third cervical nerves. These are the important points you have to remember in the Ansa cervicalis. Okay. Distribution. Superior root distribute or supplies to your superior belly of the omohyoid muscle, and the Ansa cervicalis, that means the inferior part, will supplies to your sternohyoid, sternothyroid and the inferior belly of the omohyoid part. So remember, superior part will supply to superior belly of omohyoid, inferior part of the Ansa cervicalis will supply to inferior belly of the omohyoid along with sternothyroid and sternohyoid muscles. Okay. Any doubts? Any doubts in Ansa cervicalis? Tell me the boundaries of carotid triangle. How the carotid triangle is formed? Tell me the boundaries of carotid triangle. Antero-inferiorly, superior belly of omohyoid muscle, okay. Posterior-inferiorly, okay. Middle and inferior constrictor muscles of the pharynx and also by the thyrohyoid membrane. What about the contents of carotid triangle? What are all the important contents? While writing contents, you have to mention it under 3 important heading: arteries, nerves and veins. Okay. So what are all the arteries we see in the carotid triangle? Common carotid artery and its branches, that is internal and external carotid artery. What about the veins? Internal jugular vein. Along with internal jugular vein we can see few other veins which drain into your internal jugular vein. So what are those veins? Okay, fine. What about the nerves? Which nerves we see in the carotid triangle? Vagus nerve and spinal accessory nerve, hypoglossal nerve, accessory, Ansa cervicalis. Okay, fine. Recurrent, carotid sinus and carotid body. Okay, fine. Okay, fine. How the carotid sheath is formed? Yeah, it is formed by the condensation of fibroareolar tissue. What are all the contents of carotid sheath? We have common carotid artery, internal jugular vein and vagus nerve. Okay, these are the important contents of the carotid sheath. You have to remember one important point, that is external carotid artery is not covered by your carotid sheath. It is present outside your carotid sheath. Okay. Any other points in the carotid sheath? So if we study the stop talking there. If we study the cross section of carotid sheath, we will get anterior wall and posterior wall. Anterior and posterior wall relation is a MCQ question. Okay, remember the points. Anterior wall is related to the superior and inferior root of your Ansa cervicalis or vagus nerve, I can say, and posterior wall is related to your sympathetic trunk. In few textbook it is mentioned as sympathetic chain. Okay, remember those words. Then we have Ansa cervicalis. It is a thin nerve that is formed by, stop talking, superior and inferior root of the vagus nerve. Okay, it supplies to your infrahyoid muscles, whereas the superior root is formed by the first cervical nerve, inferior root is formed by the second and third cervical nerve. Any doubts in this? No doubts? Okay. You can see here, this is the picture of Ansa cervicalis. If they ask you the question for short answers, you have to write this diagram also. So this is the inferior root and this is the superior root of your Ansa cervicalis. Okay. The last triangle in your anterior triangle or in the anterior region of the neck is muscular triangle. Okay. The boundaries of the muscular triangle, anteriorly it is formed by the anterior median line of the neck from the hyoid bone to the sternum part, and posterior superiorly it is formed by the superior belly of the omohyoid muscle, and posterior inferiorly it is formed by the anterior border of the sternocleidomastoid muscle. Okay. And then the contents of your muscular triangle is the infrahyoid muscles. These are the chief contents. Then these muscles may also be regarded or form the floor of the triangle. The infrahyoid muscles are sternohyoid, sternothyroid, thyrohyoid and omohyoid muscles. Okay. So while writing, sometimes they will ask you to mention the attachment, nerve supply and action of these muscles. So you should know about the attachment, nerve supply and action of these 4 muscles. Okay. So you can see here, this is the picture for your muscular triangle. Can you identify the boundaries here? The boundaries of your muscular triangle is formed by which muscles? sternocleidomastoid muscles and omohyoid muscles. Can you identify them? Anteriorly, it is bounded by the anterior median line from the hyoid bone to the sternum. So here we have hyoid bone and here this is your sternum. So from here to here, this is the anterior border. Okay. Next, posterior superiorly, it is bounded by the superior belly of the omohyoid muscle. So here you can see the superior belly of the omohyoid muscle, and this is the inferior belly of the omohyoid muscle. So this is the muscular triangle. Okay. Any doubts? Any doubts in this? What about the contents? Contents are, what are the contents of your muscular triangle? What are the 4 important muscles we see in the muscular triangle region? Okay. Omohyoid. Okay. Sternohyoid. Okay. So these are the 4 important muscles we see in the muscular triangular region. Okay. Stop talking, you can explain her later everything, concentrate now. So this is the tabular column for all the infrahyoid muscles: proximal attachment, distal attachment, nerve supply and action. These muscles in detail it will be discussed when they are doing the sessions for particular regions, but right now for a muscular triangle part, you have to just remember the names of all the infrahyoid muscles for a content purpose. Okay. Okay. Any doubts in this whole chapter, anterior triangle of the neck? No doubts? Okay.